Naona timu kubwa iko area. Are we ready? Nikiona Shabani hapa najua tuko sawa. Are we ready? Yeah, first I want to welcome all of you to these press statements, basically addressing the ongoing strike by the doctors. As the governor of this county, we have listened to the doctors very well, having given the strike notice nationally. For the last 1 month, the doctors have been on strike, and the issues which they are raising range from delayed posting of interns, failure to provide comprehensive medical cover. These are at the national level. I'm also aware that the clinicians and the statisticians, lab technicians have also started their strike nationally. Issues of promotions have been highlighted by the doctors as well as the clinicians and the lab technicians, delayed salaries and remuneration, the right to get mortgages and car loans. Now the status in Kakamega, as at now, we have a few services which have been interrupted with because of the ongoing strike by the doctors. And one of the services has been the surgical services, which have been interrupted with. We have the special clinics where services have been interrupted with because of the ongoing strike. We also have the theater services. Unfortunately, also in our dispensaries, because of the national strike, some of the patients are no longer even going to our dispensaries, and yet we don't have doctors there. Our dispensaries are run by our nurses, and I want to tell all the Kakamega people that our health centers and our dispensaries are working, and they are not affected by the strike of the doctors. And this is my message to the doctors who are on strike. First and foremost, the labor courts, through Justice Byram Ongaya, directed that the doctors must resume their duties in the interest of the patients as we negotiate at national level on the issues which they raised in their collective bargaining agreement. The position of Council of Governors is also the same, that doctors must put the lives of our patients first. They resume as we deal with their issues. Issues of delayed salary, some of them are already being addressed. They're no longer issues as at last month. And therefore, as the governor of this county, I want to ask all the striking doctors that tomorrow by 8 a.m., I want all of you to resume your duties. And any doctor who will not be at their workstation by 8 a.m., we shall not have any excuse other than releasing them. We are ready to employ other doctors. So by tomorrow, 8 a.m., I want all the doctors to resume their workstations so that doctors who are not going to resume, the only solution that we have is to dismiss them. So this is my message that I want to convey to our doctors in Kakamega, that I now direct you resume your services tomorrow by 8 a.m. Failure to that, then we are going to institute disciplinary measures of dismissing all those doctors who have not taken up that advice. That is my message which I wanted to commit and deliver to our people. But for the patients who are having a minor illness, our dispensaries are still open. Our nurses are there. We want to call upon the general public that if you have any medical services you want to seek in our dispensaries, those ones are opened. So sina mengi yangu ni kuambia wale madaktari ambao wanashiriki mgomo ambao unaendelea, ikifika kesho saa 2 ya asubuhi nawaambia wasipokuja kazini hatuna budi, lazima tutawafuta kazi kuanzia kesho. Huo ndio msimamo ambao tuko nao, na lazima madaktari wetu pia watilie mkazo uamuzi ambao ulitolewa kotini ya kuambia warudi kazini, ili serikali ya county na serikali ya juu ya national government tukiangalia vile tutajadili maslahi yao, lakini wagonjwa wetu wasiendelee kuumia kwa sababu ya mambo ya strike. Hiyo ndio ujumbe ambao naambia madaktari wetu, na wale wagonjwa ambao wako nyanjani mbalimbali, bado tuko tayari, tunatoa huduma zetu kwa zahanati zetu kule kwa wards, kwa health centers zetu, kwa sababu tuko na nurses ambao wako tayari kutibu wagonjwa wetu. Kwa hayo machache, huo ndio ujumbe wangu, na maswali nimesema kama mko na maswali, niko na waziri wa afya atajibu maswali yenu kikamilifu kule kwa hospitali. Asanteni.